After examining you and looking at your x-rays, I've come to the conclusion that you have slipped capital femoral epiphysis. Slipped capital femoral epiphysis is a disorder where the ball at the end of the femur, also known as the thigh bone, slips off in a backward direction. This disorder usually occurs in children of the adolescent age, just as yourself. As seen in your x-ray, the femur bone is not in line with the ball socket joint. At first, I assured that I thought you had just fractured your hip bone, but then I had done more research and I realized that that wasn't quite the issue. You slipped capital femoral epiphysis. You can walk and bear your own weight, however, you just won't have your full hip flexibility along with turning your hip inwards. And you were able to put weight on your legs, so you do not have a severe case of the disorder. However, the short terms, you should get it treated as soon as possible with surgery, which they'll usually just put a screw in to hold it in place. And after surgery, you most likely won't be able to put weight on your leg and you'll be on crutches or in a wheelchair. However, if you don't get it treated soon, it can lead to disabling conditions and early base degenerative hip arthritis. And then eventually after that, you could require hip reconstruction, and you would not want that. And what you have the stable case of the disorder, which means that it causes some stiffness or some pain in the knee and the groin area, and possibly you can develop a limp as you have, and then the pain and the limp usually tend to come and go, worsening with activity and getting better with rest. With stable SCFE, which is the slipped capital femoral epiphysis, a person is still able to walk, but even if crutches are needed, but you should get it treated. However, you do not have the unstable disorder, which means that it's much more painful and the child not be able to bear their own weight. And because of the range of motion is severely limited, the unstable SCFE is also more serious, and it can restrict blood flow to the hip joint, leading to tissue death in the head of the femur. So I understand that you are in a lot of pain, and it might be scary only because it's not a disorder that doctors treat very fast. They usually mistreat it because they don't know that it's a disorder, but I think that that's what you have, and you should get surgery as soon as possible.